Hi, it's Jackie from Parham Physiotherapy Solutions, back again with another short video just to demonstrate one of the physiotherapy-led Pilates exercises that we use in clinic. It's the leg pull-in prone. Now, if I tell you it's like a plank, it probably makes a bit more sense than leg pull-in prone, and planking is essentially what it's taking you up to. So we all love a plank. It's a great exercise to get your core working, your glutes, your hamstrings, and also to work these shoulder blade stabilizing muscles and your rotator cuff when you get that co-contraction through your shoulder. So it's a really good exercise for both lower limb rehab and upper limb rehab, as well as your low back pains. Now, the problem we often see is that if people are using a plank as a daily exercise and their technique isn't optimal, they can start just to get a bit of an ache in the lower back. And this is where I'm hoping that by showing you the levels that we can use to progress up through the leg pull-in prone, you'll be able to take a level that you feel comfortable at and use that to strengthen all these muscles and take you up to that optimal level for you. So we start the exercise in 4-point kneeling, and we start with the leg pull-in prone preparation, okay? So if you've seen my other videos, you'll probably have seen this position previously. So you're going to start with your shoulders directly over your hands and your knees directly under your hips. And from here, I just want you to do a small tilt of your pelvis posteriorly, so you tuck your tailbone under and round your back up to the ceiling, and then you reach your bottom to the ceiling, lowering your back to the floor, and you get that anterior pelvic tilt. Do that a couple of times just until you feel comfortable to find your neutral spine position. You can then engage through these core muscles, which is where you'll feel that band of tension between your two hip bones. I then want you to walk your hands about a hand's length in front. So now your shoulders should be about 110 degrees flexion, and you're going to tuck your toes under. Okay? So for the leg pull-in prone prep 1, we simply hover the knees just a very small distance up off the mat, and then lower down. Now while you're doing that, I really want you to think about what's happening around your shoulder girdle. So you're going to press down through the palms of your hands and push the floor away from you, and then lower back down. Now you're not looking to transfer your body weight here, you're just literally looking to hover, and then lower down. And actually the lower you keep your knees, the harder the exercise is. And we often tell people to exhale as you lift, because that helps you to engage your muscles. Take a breath in whilst you're elevated, and then you breathe out as you lower down. And I tend to recommend that people do that between 8 and 10 repetitions. Now often people do say, oh, I've got dodgy wrists, I can't do that. And obviously at home I don't have all our clinic equipment, but you can use a towel, is quite nice. So if you find that it's too much wrist extension, you can place the palm of your hand on a towel, and that will take out some of that pressure through the wrist. Or if that seems a bit faffy, the other thing I get people to do in the classes is you just roll the mat up a little bit here. This isn't a great mat, so I need to roll it a few times. But then you can place your weight through your hands here, and again, that will stop so much wrist extension when you're doing the exercise. The other problem people often say is, oh, I've got a bunion, or I haven't got that extension motion in my big toe. And so for that, you could use something like a block, like a Pilates block. And you could rest your feet, if I move that back a bit actually. You can try resting your feet on the block, okay? And it actually makes it a bit harder, but then you can look to hover your knees here. And then you can see that you're not getting any extension in your big toes. Or the other option, if you really wanted to feel the challenge as well, is you could get your foam roller. This is one of the hard ones, I prefer the softer ones normally. But again, you can rest your feet on here, and this will actually challenge your core more because it's mobile. And you can lift from here. Pushing that floor away, lengthening through the neck. and then lowering down. Okay, so that's your leg pull and prone prep 1. Then for leg pull and prone preparation 2, assume the same position, so start 4-point kneeling again, but this time walk your hands probably 2 hands lengths in front, so you're about 140 degrees shoulder flexion. Again, tuck your toes under, and this time I almost want you to think as though you are catapulting yourself out the cannon. Okay, so you're a cannonball shooting out that cannon, so it's more of a propulsion forwards. So you take a breath in to prepare, and then as you breathe out, you push your body weight up and forwards until your shoulders are almost over your wrists. And again, you can stay strong there through your centre. Try and keep your shoulder blades down, but push the floor away from you. And then you bring yourself back to that 4-point kneeling. So you're going to exhale as you push up. Hold it for an inhalation, keeping strong through your core, and then lowering back down. Now, to make that harder, you can do more repetitions, or you can try and hold it for longer. Okay, and then the next level up is your leg pull and prone. So we've done the preparation, the leg pull and prone is the next exercise. So you assume the same position as you did for leg pull and prone preparation 2, so that's your 140 degree shoulder flexion, knees over hips. Tuck those toes under and assume the plank, long arm plank. Now from here, you take your inhalation here, so take your breath in, but this time as you breathe out, you're going to hover one leg up and reach it to the back of the room and lower it down. And then you repeat that with the other side. So you exhale as you hover the other leg and lower back down. So when you're doing this, you're still thinking about pushing the floor away, lengthening through your neck, and also trying to keep those hip bones facing directly forwards, so they're pointing down towards the mat. Good. And then you come back, and it's always nice to finish with a little child's pose stretch. So they're your 3 main exercises. What it can be quite nice to do is just add in some modifications, stop you getting bored, and also it can help to challenge your core a bit more. So if you're at the leg pull and prone stage, the options you've got for a couple of modifications would be 4-point kneeling, 140 degree shoulder flexion, pushing that floor away with your hands, so you're really reaching your chest away from the mat. You assume your long arm plank, and then you can look to march. So you lower one knee down to the mat at a time, trying to prevent movement in your pelvis and your lower back. And it's quite nice to say, I'm going to do this for a set period of time. Okay? Your other option is when you've brought the leg into extension, bring it into a small amount of abduction, so out to the side and lower, extension, out to the side, back in and lower. So I hope you've enjoyed those couple of exercises, stop you from going mad in this time of isolation. Hope you're all well and safe, and I'll catch up with you soon. Take care.